As we begin our study of the human body, we need to have some common terms. So we're going to talk about anatomical terminology. One of the first things we have to do is determine how the body is going to be positioned when we talk about it. We can read a road map and know north, south, east, and west because we have all agreed that the way the road map has to be laid out so that we all read the same directions. The same is true of the human body. This special position that the human body must be in when we describe where things are is called anatomical position. This is our common reference point. Anatomical position, you are standing erect, facing forward. Your arms are down at your sides, but your palms are facing forward. Now, this is not a natural way to stand, but it does give us a front and a back to everything. When we talk about doing things to the human body, auscultation is examining by listening. You use a stethoscope and listen to stuff. Palpation is when you examine by touching. Now let's look at a few terms that describe parts of the body. Cephalic has anything to do with the head. Buccal has to do with the cheek. Acromial is that point on your shoulder. That's the acromion process. Axillary is your armpit. Thoracic is your chest cavity. And right down the center of your chest cavity in the front is the sternal region. The bone underneath here is known as the sternum. The upper arm is brachial. The bend in the elbow is antecubital. The wrist is carpal, and the palm of the hand is palmar. Your fingers and your toes are referred to as your digits, so anything referring to them is digital. The area below your diaphragm, most of the part of your lower body cavity, is the abdominal area. Right in the center of the abdominal area is your belly button. This is the umbilical area. The coxal area is that part of your body that's sort of the side of your hip. The inguinal area is the area where your leg joins your body. The pelvic area is that area that rests down inside your hip bones. And the pubic area is the area of your genitalia. Femoral means the thigh, the top of the leg. Patellar has to do with the knee. Tarsal has to do with the ankle. As we look at the back, occipital is the back of the head. Cervical has to do with the neck. Right down the center of your back is vertebral, and over your shoulder blades is scapular. Olecranon is your elbow. Your lower back, that curvature of your back, is lumbar, and just at the base of that is the sacral region. Now, the large, fleshy part of your hips is gluteal. This is also sometimes referred to as your buttocks. The perineal region is actually on the bottom of your body. It's the area between your anus and your external genitalia. Popliteal is the back of the knee, and calcaneal is your heel. The bottom of your foot is the plantar surface. Directional terms help us tell where things are. Anterior means the front of. Ventral also means the front or the belly side of something. Posterior means behind. This is the buttocks area of the body. And dorsal means the back, the spine area. You can remember dorsal because sharks have a dorsal fin that runs along their back. So here we see the anterior view, or the ventral surface, and the posterior view, or the dorsal surface. Additionally, we have words like superficial, which means on the surface, and deep, which means beneath or underneath the surface. We talk about a muscle being superficial to another muscle, or a structure being deep to some other structure. Lateral means toward the side, and medial means toward the midline. Superior means above, inferior means below. Cephalad means toward the head, and caudal means toward the tail. Now, cephalad and caudal are used more on animals. In humans, we use superior and inferior. So as we look here, we have lateral, meaning to the side. So if the liver is right in here, this could be the lateral surface of the liver. Medial would mean toward the midline, so the part of the liver that's in here would be the medial surface of the liver. Superior means above, and inferior means below. The thoracic cavity is superior to the abdominal cavity. The extremities, the arms and the legs, give us a little more challenge. Proximal means closer to the point of origin of the limb, and distal means further from the point of origin. You can remember distal because distal sounds like distance. So when we're looking at the arms and the legs, distal means away from the point of origin. So we can say things like the elbow is distal to the shoulder, or the ankle is distal to the knee. Proximal means closer to. So here the elbow is proximal to the hand. The knee is proximal to the ankle. We also frequently cut things up into pieces, and it's important for us to know how we cut something. So these are our planes and sections. If something is cut so that you have a front and a back piece, that is a frontal or coronal plane or section. If something is cut so you have a top or a bottom, that's a transverse cut or section. If something is cut right down the middle, that's a median or mid-sagittal section. You get right and left halves. However, you may cut things into right and left pieces, not exact halves, and that is called a sagittal cut. There are several body cavities that we need to talk about. Your dorsal body cavities are those along the back of the body, and your ventral body cavities are those on the belly side. Your dorsal body cavities can be divided into the cranial body cavity, which houses the brain, and the vertebral cavity, which houses the spinal cord. Your ventral body cavities, we have the thoracic or the upper one. This holds the heart and the lungs. And then we have the lower ones, the abdominal cavity and the pelvic cavity. Now, the abdominal cavity houses the digestive organs, and the pelvic cavity houses the reproductive organs and the urinary bladder. Sometimes this whole area is referred to as the abdominopelvic cavity. We can divide the abdominal area into 4 quadrants. By knowing what is under each quadrant, when doctors palpate a region, they can tell a little bit something about what's going on in the body. The right upper quadrant is where we're going to find the liver and the gallbladder. The left upper quadrant has the spleen and most of the stomach in it. The right lower quadrant is where we have the appendix. And the left lower quadrant is where we have the descending colon and the sigmoid colon. There are some other body cavities. The orbital is the eye socket, and the nasal cavity is behind the nose. As we look at this side view, here's another view of the nasal cavity, and then we have the oral cavity, which is the mouth. The middle ear has a hollow space in it, and in between the bones we have cavities. These are known as synovial cavities. The digestive area is any place along the digestive tube from mouth to anus.